real thing that Beacon is going to be bringing to Southeast Michigan and to providers in this area is the opportunity to do two things. Number one is connect to each other in ways that we haven't before. And then number two, I think, and something that Beacon is doing differently and special from, I think, others, is really focusing not so much on the technology, but more so on the people and the processes of care coordination, of getting the patient from point A to point B in a complex care system. And I think that's where Beacon is really going to excel.
What we're doing is very innovative. Usually data is exchanged from doctor to doctor, point A to point B, and it's very fragmented. So what we're doing is we're bringing all the data to center in real time. So what we're trying to do is do it in a very transparent way to the provider. They don't have to worry about going to a portal or going to another application. Patient checks in, pulls that patient behind the scenes right into the medical record. Patient's sitting in front of the provider, and their complete longitudinal record is sitting in their inbox.
Being a neutral platform, health information exchange for the Southeast Michigan community, is that allows physicians to leverage the existing technology that they have already invested in, that they don't have to spend any additional dollars for another tool. They can stay within their current platform and still reap the benefits of what BEACONLINK2HEALTH has to offer.
If I don't know about the meds that a patient's on, if I don't know about the decisions that another care provider has made, then I can't really accurately and safely take care of that patient. So using things like BEACONLINK2HEALTH will help providers to gain that knowledge about the patient, to understand the entire context much better than they could in the past, and really improve the quality, improve the safety, reduce the cost, and improve the satisfaction of both the patient and the provider.
The biggest benefit is that it really provides an infrastructure to minimize the gaps in transitions of care. So folks who have a chronic condition, particular diabetes, they really can have the best possible treatment because everyone who needs to know about what's going on or if there's a change will be in that communication path, and that's vital.
We'll be able to expand beyond Southeast Michigan, go across state lines to exchange data for those patients that travel.
I think from the state's perspective, one of many valuable things that BEACONLINK2HEALTH brings to providers is available for connectivity, and the ability to exchange data in Southeast Michigan is key. And then from there, I think we have great improvements in quality and the delivery of care.
Beacon becoming a qualified data sharing organization is a really important step in their evolution. It's sort of the formal stamp of approval that Beacon is one of the players in the state that you can go to and rely on for data sharing. So they are both a source and a destination for sending clinical information to.
There are new challenges facing healthcare providers. Now, when I send that patient out, I'm still responsible. I'm still the physician for that patient. I'm still the provider and the caregiver. And therefore, I can't just assume that they understood everything that I said, that they fulfilled every requirement, that they got every medication, that they were able to move on to the next provider, or that that provider knew what I wanted to happen. So all of those things are what BEACONLINK2HEALTH is about getting the right information to the right provider at the right time in the right format so that we can provide the right care. And taking those opportunities to really continue the responsibility throughout the lifetime of the patient is what we're headed towards, and why these kind of technologies and processes are so important to the future of medicine.